COVID-19. It's important to know about it and the vaccines and staying away from getting it yourself. And we have Dr. Kevin Kavanagh here, retired physician and founder of a national organization called Health Watch USA. Dr. K, good morning, sir.
Good morning, Jack.
Tell us about Health Watch USA, what caused you to start it and where it's come and where it is and where it's going.
Well, we're a nonprofit organization. We formed over a decade ago, and primarily for patient safety, trying to improve safety of patients in their health care that they receive at hospitals and even on outpatient basis. And we've started with a small core group of people in Kentucky, and this has now expanded really nationwide. We have members from all over the nation and even a few people who help and support us worldwide, and so I also consider them members. We're primarily a policy organization looking at research and healthcare policy, but we also have a very strong arm of patient advocacy, and we have a number of patient advocates which are members of our group.
All right. Now, along the way here is we're going to be talking about the disease itself and also the vaccines, et cetera. We begin this morning with some good news. Tell us about Pfizer and Moderna's vaccine.
Yes, well, both Pfizer and Moderna are gearing up production. And not only that, but the initial results coming back on testing on the variants from South Africa and Brazil show that these vaccines have efficacy. Now, the efficacy may be reduced as much as 3 to 6-fold, but because they are so strong against this coronavirus, they feel that that's enough to avoid severe disease and death. And so that's really good news. It does probably indicate that we will need to have a booster or have this vaccine tweaked later on in the year, but I do think that that is something that we can be thankful about. However, the one word of caution is we need to follow public health advice because this virus is maybe one iteration away of avoiding these vaccines, and we do not want that to happen.
Well, that's good. I like good news. Now, it says here Pfizer and Moderna vaccine now states effective after one dose above 90%. Now, is that going to discourage people from getting a second one?
It may. I would not suggest that. I would still get a second one. And of course, that second dose, it's a little bit stronger reaction than the first. So you need to be prepared for that, maybe planning on being off of work the next day because you can get some fevers and feeling very tired. So I do think it's good news, but the one thing we do not have is how long this immunity lasts. And so although it may be as effective, there's not much difference between 90 and 94%, but the one problem is how long does it last? And we don't know that. And certainly getting that second dose would be expected to give you immunity that lasts longer. So if you can get that second dose, it does mean, in my mind, that if you can only get one dose, for sure, go out and get that, but you still need to be searching for that second one.
Okay. I heard a comedian, and I thought it was very funny, say the whole wear two masks thing was a plot to get people that aren't wearing masks to wear one, i.e., these people out there that are going, I'm not going to wear a mask. They tell me to wear a mask. I'm not going to wear a mask. Now they're telling me to wear two masks. So here's what I'm going to do. I'm just going to wear one mask. I thought that was funny because obviously it's not true that it was a ploy to get the people that aren't wearing masks to wear at least one. But I could see how that could almost happen with people out there that just simply don't want to be told what to do.
Well, and that's correct. But there's good data behind wearing masks now. Of course, we've been advocating that early on. Our group said that before even the CDC, and we've been concerned about aerosolation of the virus since July and August of last year when we started talking about N95s and making sure that you have proper ventilation. But some of the new data coming out and reasoning from the National Academy of Science is really sound. And one of the things is, Jack, is that the viral particle size that it takes to aerosolize has now increased from below 5 microns to 10 to 100 microns. It can aerosolize up to 100 microns. Now, this is bad from the aspect that it means that loud talking and singing can probably fill a room full of aerosolized viruses that can float around and infect people. That's why there's this big push to wearing a second mask to make sure that first mask is around your face and fits tightly. But the good news in this is that the larger particle size makes it easier for N95 masks to filter out the virus, and it also increases the efficacy of a cloth mask because these are larger particles. And so there's some bad news as far as what we need to do to stay completely safe. There's good news as far as the efficacy of wearing a mask. So please do that. And of course, get a vaccine, because that even gives you a more stronger layer of protection against this whole problem of whether or not indoors is safe. For me, as I've said repeatedly, everything that I do, I try to do with curbside pickup or delivery. I avoid indoor settings unless I absolutely have to go inside.
Now, I understand that President Biden has dissolved the COVID-19 panel that advised during the transition. Can you tell us any more about that?
Well, that was a small article which was in Stat, and yes, it has been dissolved. And we got onto this because there was a letter we came across from Dr. Osterholm and Dr. Bright. They were on the coronavirus task force, which was sent to the White House and to the director of the CDC stating, this virus aerosolizes. We're not doing enough to protect people, our workers, etc. This is sort of what we just talked about. And all of us were thinking, but these guys are on the task force. Why do they have to send a letter to the White House? I mean, what's going on here? And on some research, we found out that, yes, the task force has been dissolved. Now, there's a bunch of good reasoning, kind of like what we heard when the pandemic response team was dissolved. But nevertheless, this is very ill-advised. I mean, if President Trump would have dissolved the coronavirus task force, he would have been skewered and roasted over a fire. I'm sure of that. Look what happened when he just postponed or canceled meetings. So this, to me, was quite concerning. It's quite concerning of the scientists that wrote a letter to the head of the CDC expressing concerns about aerosolization. They cited the National Academy of Sciences report, which was in December of last year. But as you know, Jack, we've been saying that from early on last year, and there were a number of scientists around the world that were concerned about this. And for those of you out there who are listening in saying, well, scientists are waffling and going back and forth and they don't know what they're talking about, I can assert that that's primarily just from political pressure. I mean, our group has been on target with this from the beginning. So have a lot of the scientists that I work and consult with around the world. This has been well known, and we should have been doing this from the get-go.
All right, here's a text on our Auto Tech Service text line. I have been having a great year, no sickness at all, gave credit to all of the precautions of hand cleaning, etc. Took the first Pfizer dose, ran 103.5 temperature, sick for 3 days, am afraid of dose number 2.
Well, for that, I would definitely consult your medical provider, because I think with that type of reaction and with the new information coming out, who knows what is going to be advised. But I will tell you that when you run a high fever, that means you're getting a good response to the vaccine. And that is a good thing with the coronavirus, because remember, the coronavirus doesn't always cause a good immunological response with a natural infection. So that type of response with the vaccine is something that you'd want to have take place. Certainly for the second dose, if you're running a high fever, I would call up your provider, see if you can't take some medication afterwards, such as aspirin or Tylenol to suppress it, but only do that under the direction of a doctor. And as we discussed before, don't take those medications prophylactically or before you get the vaccine.
Here's something that I think is important and something that is very scary, Dr. K, and that is U.S. life expectancy fell by a year.
Well, that's correct, and that's been reported by the CDC. In the white population, it fell less than that, 0.8 years, but in the African American and non-Hispanic Black population, it fell 2.7 years. So it depends upon your race. There's racial disparities in this, and this has to do with the devastation that we've seen last year, along with a number of excess deaths that are reported. Newsmax, and I'll use Newsmax as a source to really drive home this number, reports that the CDC feels that there are nearing 600,000 excess deaths last year from this pandemic. And that means people dying early. And we'll, of course, always hear, but they would have died anyways type of argument from those people who don't have a caring heart. But the fact of the matter is, a premature death is premature, and we're all going to eventually die. I mean, we're alive, and that's one of the consequences of life. If you looked at the 1918 flu pandemic, 90% of those individuals had a bacterial infection of the lungs. You could say they died of that, but in essence, they didn't. They died prematurely, the whole thing put into motion by the 1918 flu virus. So this is a horrible type of a figure. Luckily, rates are going down, vaccines are coming out, and I'll be honest with you, Jack, this cold snap is kind of like a Mother Nature lockdown. It's been going on now for over a week, and I think that we're going to see a huge drop in the pandemic because of that. And at least that's what I'm hoping. And if people do follow public health advice, especially up until you can get that vaccine, I'm telling you, Jack, I think we may get this under control. What we don't want to happen is to have the South African and Brazilian variants to take over and then spread in our nation. So we need to keep up our guard, but things are going in the right direction.
Very good. That sounds good. Now, we've heard that zinc and vitamin C can help. That is not true, right?
Yeah, the new studies out from JAMA Network really does not look like that's going to be very beneficial with this virus. However, for those of you who like supplements and vitamins, vitamin D has been getting more of a positive review in the medical literature, and there's more positive articles regarding that. Now, there's not a whole lot of randomized controlled trials to say that it works for sure, but at this point, I'm telling you, you should not be vitamin D deficient. You want to make sure you've got a good vitamin D level. And of course, that goes along with just about everything else, such as healthy buildings and schools, not being vitamin D deficient, cleaning your hands and having good hygiene while preparing your food. We should be doing all of that anyways.
All right, Laura. Let's go to Laura. Hello, Laura.
Good morning, Jack. Good morning, Doctor. I've got a question about your CDC figures, Doctor. Are those also, you said they're broken down by race. Are they also broken down by income, socioeconomically? I really think that if the poverty-stricken white people realize that they're in the same boat as the minorities, and that's where their interests lie, maybe they'd lighten up on the racism problems. Just an idea. Thanks.
I have not seen them broken down by income, but certainly that's a factor. I don't think that this is so much a genetic problem as it is a problem that who are the frontline workers, who are the people that are delivering the groceries, who are the people that are driving the buses. All of this increases exposure, which increases the risks of death. And so, yes, it is a huge problem with income inequity. There's also a problem with access to health care. So you've got multiple problems here. But if you get access to the health care, you get a test right away, you may be able to isolate yourself, you may be able to prevent transmission to other family members and friends. So it does impact everybody. And so we really do need to look at our healthcare system and get something that's a little bit more equitable, actually a lot more equitable for all of the citizens in the United States.
Have a great weekend. Thank you, Doc.
Thank you, sir.